friends, welcome to EZI Nurse, where nursing education made easy. So you all are preparing for your upcoming main exam. Still there will be a lot of confusion what to study and how to study, then how to remember the topic. So in this session, let us discussing about the main repeated and the important questions they are going to ask for your main exam, third year GNM community health nursing. Let's start the session. So they'll be asking like a national health problems. So when you coming to the national health problems, first, let us discussing about the what do you mean by health. So there will be a lot of problems will be there related to the health. First, we'll be discussing what do you mean by health. Health is a state of the complete physical, mental, social well-being and not merely the absence of the disease. As a person, when you're going to say he is a physically healthy, so it should be health from all the aspect. As the WHO has given the definition, it is a complete physical, mental and the social well-being. So when you coming to the health problems, so health problems, and when a person who is having a health problems, it refers to any condition that negatively affect an individual, either it may be with the physical, mental or a social well-being. That is a state of the ill health or a unhealthiness, what you are going to call that person is having a health problems. So when you coming to the assessment of this health problem is a main factors that is implementing for the planned health efforts to develop the healthcare services. So when you coming to the major health problems, so you all are come across in a community setup like there will be many health problems. It will be there. Either it may be a communicable diseases. It will be there for the peoples or a non-communicable diseases. Either it may be a nutritional problems. Then that will be affecting with the health problems. Then environmental problems. What you are going to focus with the day-to-day activities. Along with that, there will be population problems. So these are the major health problems that will be impacting for the population in the community. Let us discussing about the communicable diseases. So when you coming to the communicable diseases, under the communicable diseases, first one is the tuberculosis. Let us discussing about this tuberculosis. What do you mean by this tuberculosis? Tuberculosis is an infection caused by the mycobacterium tuberculosis. So it is one of the airborne transmission. So it is one of the airborne transmission. Inhalation by the droplet nuclei. Usually it will be inhaled by the droplet nuclei. When a person with a active pulmonary or a laryngeal tuberculosis, when the person has cough, sneeze or speaks, it will be transmitted. So when you coming to this tuberculosis, what are the main signs and symptoms you will be come across with the patient? That person will be having a long-term coughing will be there. Along with that, coughing up with the blood. Then the person will be having a chills, fever, chest pain, and that person will be having a fatigue. So this is the common signs or symptoms you will be coming across with the patient who will be having a tuberculosis. Then how we are going to do a diagnosis with the condition of the patient who will be having a tuberculosis? Usually we are going to diagnose this condition with the presence of the clinical features, like the person who is having a fever and the long-term cough, it is there. Along with that fatigue, it will be there for the patient. So on the basis of this presence of the clinical features, you are going to diagnose the condition. Then along with that, for the confirmation of the purpose of this particular tuberculosis condition, you are going to do the test like the tuberculin test, that is a Montague's test. Then we are going to do with the chest x-ray history of the contact with the adult infected person, like the person who was in a contact with the tuberculosis patient, like in a particular community. If the other person who is having a tuberculosis, if the healthy person who has contact those persons, so there will be chances of getting a tuberculosis. Then along with that, we are going to do for the confirmation ELISA test along with the histopathology. So these are the diagnosis test we are going to do for the tuberculosis condition. Next, we will see what's the treatment aspect. Usually we are going to give for the patient who will be having a tuberculosis, usually with the dot therapy. You all are come across in the community health nursing, like you have heard that is a dot treatment, that is a direct observed therapy for the tuberculosis we are going to give for the patient who will be having a tuberculosis. Tuberculosis is typically treated with the combination of the antibiotic for a course of the several months. Usually for the 6 months we are going to give, started set the treatment regimen for the active tuberculosis, usually in the intensive phase. When the patient who is having a tuberculosis, for the first 2 months, that is what we are going to call as an intensive phase. In those conditions, that is in that particular phase, we are going to give the drugs like a rifampin, that is we have to take daily. Then isoniazid, it should be taken daily. Along with that, vitamin B6 we are going to give to prevent the peripheral neuropathy. Then along with that, we are going to give pyrazinamide, that should be taken daily. Then ethambutol. So these are the drugs we are going to give. Then continuation phase of the next 4 to 7 months, we are going to give rifampicin, that is we are going to take daily for the next 3 weeks. Then continuation phase, it should be taken, that is the next 4 to 7 months, that is the rifampin, that is taken daily three times a week. Along with that, isoniazid, we are going to take daily 3 times a week. So this is a treatment regimen we are going to give for the patient who will be having a tuberculosis. This is about the tuberculosis. Next we will see the another communicable disease condition, that is a malaria. So what do you mean by this malaria? So usually how it is going to cause for a person who is affecting with the malaria. So malaria, it is a causative organism, usually by the plasmodium parasite. Usually it is like a vector-borne disease transmitted to the people through a bite of the infected female Anopheles mosquito. When the mosquito, that is the infected female Anopheles mosquito, when it is bited to a person, so the person will be getting a malaria. So usually what are the clinical features you will be having come across with the patient who will be having a malaria? That person will be having a fever, chills, and the sweating will be there, headache, nausea, vomiting, muscle pain, and the fatigue. Along with that, anemia and the jaundice. In a severe case, you will be come across with the patient. Then there will be having a seizure, confusion, and a coma. In a severe case of the patient who will be having a cerebral malaria. So these are the clinical features you will be having. Then what the treatment usually we are going to give for the patient? The treatment, it will be there like a anti-malarial drugs. Usually we are going to give for the patient who will be having a malaria, like a chloroquine, quinine, and the mefloquine we are going to give for the patient who will be having a malaria. So this is the condition about the malaria. Next, we will see the other communicable diseases. So usually what are the other communicable diseases? It will be there for in the particular community setup, like a ulcer, hepatitis, respiratory tract infection, helminth infestation, among other communicable diseases you will be come across with the patient. Then along with that, there will be having a other communicable diseases like a smallpox, chickenpox, measles, rubella, mumps, influenza, diphtheria, whooping cough, brucellosis, leptospirosis, plague, and the human salmonellosis. So these are the other communicable diseases. Next we will see the nutritional problems. So when you're coming to this health problems, we have seen the communicable diseases. Then coming to the nutritional problems. So which are the nutritional problems that will be existing, when the patient who will be having the we are going to consider these are the nutritional problems means. So there will be having a iron deficiency anemia. Iron deficiency anemia is caused by an inadequate dietary intake of the iron. Poor absorption will be there. Along with that, there is a chronic blood loss will be there. So it is prevalent among the children, adolescents, and the women. So this is the most commonly you are going to see with the children, adolescents, and the women, that is a iron deficiency anemia. Next one is a iodine deficiency disorder. So when you coming to this iodine deficiency disorder, it is also one of the nutritional problem. So usually a cause of the goiter, hypothyroidism will be there. Then along with that, developmental delay you will be come across with the children's with the who will be having a iodine deficiency anemia. Iodine deficiency disorder, it is another nutritional problem. So usually causes the goiter, hypothyroidism, and along with that there will be developmental delay you will be seeing in the children's. Iodine deficiency is a particularly a problematic in the mountainous region, in a mountainous region. So that is a common problem in those regions of the peoples. Next one is a zinc deficiency. So zinc deficiency is result in the growth retardation with the children. Along with that, there will be impaired immune function will be there. Then there is a increased risk of the diarrhea will be seeing with this condition. Then there is a respiratory tract infection in the children. Then next one is a vitamin D deficiency. So you'll be heard that the vitamin D deficiency, if it is leads to the cause of the rickets in the children and in adolescents, it will be there like osteomalacia, resulting with the weak bones and the skeletal deformity. It will be there for the children's and the women's. Next condition is a folic acid deficiency. So it is a most important for the giving a pregnant woman, like a importance for the pregnant woman to prevent the neural tube defect in the newborn. Next, other nutritional problem like a underweight. So usually underweight when the children is born, if the birth weight less than the 2.5 kg, we are going to consider the child is a low birth weight baby according to the age. Like the low weight for the age, it will be there indicating that there is a combination of the chronic and the acute undernutrition. Then next one is a protein energy malnutrition. So it is a most common condition will be coming across with the children's. Inadequate intake of the protein or a calorie common in the children's and the women's for the reproductive age. So other deficiency of the nutritional problems like a vitamin A deficiency. When you coming across with this vitamin A deficiency, so it is one of the significant public health problems, especially you are coming across with the community. So particularly in a developing countries, it will be there. Though one of under that vitamin A deficiency, there is a night blindness, that is a difficulty in seeing in a low light or a darkness, it will be there. Then xerophthalmia, so a spectrum of the eye condition that will be including with the dryness, bright spots or a corneal ulcer that can be leading to the blindness. So these are the common nutritional problems you will be coming across with the peoples in the community setup. Next, we will see what are the contributing factors for the nutritional problems. So what are the contributing factors for the nutritional problems? Why the nutritional problems that is going to occur? So the main condition is a poverty. So poverty, if they are not having a proper amount of the to get the particular grocery, the whatever the food requirement will be there. So because of the poverty, they can't able to get. That is also one of the problem. Next one is a inadequate maternal and the child care. Like on the basis of their cultural practices or because of the poverty or inadequate knowledge, what will happen? Inadequate maternal and the child care, it will be there. So that will be one of the impact for the nutritional problem. Then for sanitation and the hygiene. So poor sanitation and hygiene, like if they are not maintain the proper hygienic measures to take care of their health. Then lack of the nutritional education. So they are not having a proper amount of so they are not having a knowledge about on the nutritional requirement for the body. So because of that also there will be impact for the nutritional problems in the community setup. Next, we will see how to prevent and control of the nutritional problems. So when you coming to this prevention aspect, there will be 3 levels of the prevention. It will be there. That is a primary prevention. So usually how we are going to do the primary prevention? So before occurrence of the condition, that is if the nutritional problem is going to occur, for the prevention of that only we are going to take the extra measures, that is giving a proper nutritious food for the people. So by that we can able to prevent. Then secondary prevention is that is by giving a so next one is a secondary prevention, that is early diagnosis, and we are going to give the treatment, that is by the giving a proper healthy nutrition with the children and the women, especially in the Anganwadi they are going to give. So it will be prevention of the occurrence of the diseases. Next, the tertiary prevention, it will be there, that is especially we are going to rehabilitate the children, especially if they are having a malnutrition and so with the tertiary prevention we are going to give the treatment. So these are the levels of the prevention of the nutritional problems. Then coming to the health promotion, how we are going to give the health promotion for the prevention of this nutritional problems, or if the children are a women or the people who will be having a nutritional problems, how we can able to promote the health by taking a proper family planning and the birth spacing. So that is the most important, that will be impacting on the health of the mother and the taking care of the children also. Next one is measures directed to the pregnant and the lactating women. Like if the mother who is pregnant, so by that time we are going to give the proper folic acid treatment. Then along with that we are going to educate the mother to take the balanced and nutritious diet. Then promotion of the breastfeeding. So whatever the nutritional problems we are going to see in the children, for the prevention of that we have to promote for the breastfeeding. We have to educate the mother to give the exclusive breastfeeding till the 6 months. Then after that we have to start with the complementary diet. Next one is the development of the low cost of the weaning food. Like whatever the availability of the resources of the food, it will be there with the protein rich. With there we have to educate them to give with the low cost weaning food. Then measures to improve the family diet. So whatever the cultural aspect is there, on the basis of that we have to educate that how much the requirement of the nutritious food they have to take for the prevention of the nutritional problems. Next one is home economics. So we have to empower the women by giving a proper skilled training, so they can able to increase their financial status. So it will be help for the prevention of the nutritional problems. So this is how we are going to prevent and control of the nutritional problems. Next, what's the role of the nurse in the nutrition? As a nurse who will be there as a community health nurse, so what are the roles she will be taking for the prevention of this nutritional problem? So first one is she has to assess the nutritional health needs. So who all are need the nutritional need assessment, that is so first one is the assess nutritional health needs. So she has to assess like who all are having a requirement of the nutritional needs, especially for the mothers and the children's. Next, nutritional surveillance she has to do, that is in a community setup. So either with the monthly wise she has to take the proper surveillance on the basis of the nutritional needs. Then health education, she has to give the proper health education about the requirement of the nutrition for the body, then how they can able to promote the health. Then she has to give the nutritional supplementation, like example vitamin A prophylaxis they can able to give for the prevention of the night blindness and all. Then national nutrition programs, they have to conduct the national nutrition programs. Then along with that like a ICDSC program, so it will be implementing for the promotion of the health of the women and the children. Then in service education and the training, especially like who all are there like ASHA workers and the health workers, so they have to give the proper in-service education and the training in the promotion of the health of the peoples, especially related to the nutritional health problems. Next, special care for the vulnerable group like old age peoples or women with the pregnant mother or a postnatal mothers and the children. They all are considered as a vulnerable group, so they have to take the extra special care for those them. Then community participation, along with that referral services she has to give. Then record and the reporting, like what are the surveillance they have did, then what the health assessment they have did, then what's the implementation they have done for the particular nutritional problems. They have to give the proper recording and the reporting, participation and the research, then evaluation. So these are the role of the nurse in the nutritional problems. Next one is coming to the non-communicable diseases. So when you come across with this national health problems, we have seen the communicable diseases and nutritional health problems. Now we will see with the non-communicable diseases. So when you coming to this non-communicable diseases is a condition. So when you coming to this non-communicable diseases is a first significant health burden in India, accounting for a large promotion of the morbidity and the mortality rate. So when you coming to this non-communicable diseases, you all are come across with that there will be, so cardiovascular diseases you will be seeing, that is usually with the coronary heart diseases and hypertension, then stroke, heart failures, this and all will come in the cardiovascular disorders. Then there will be cancer. So when you coming to this cancer, it is also one of the morbidity and the mortality rate in India, that will be having like example oral cancer, lung cancer, breast cancer and the cervical cancer. Then like other non-communicable diseases like chronic respiratory diseases, like you have seen like a person will be having a chronic obstructive pulmonary diseases, asthma. So these are the other non-communicable diseases. Then under the type 1 diabetes and the type 2 diabetes. So these are the non-communicable diseases you will be seeing nowadays in India. It is one of the main factors for the morbidity and the mortality rate in India. Then how we can able to prevent and control this non-communicable diseases? So usually we are going to prevent this non-communicable diseases. We have to give the proper health promotion. That is a health promotion. We have to educate the peoples in the community setup about their healthy practices of the lifestyles, then choosing, that is especially with the balanced diet and the physical activity. Next one is screening and the early diagnosis. So like if the person who is having any health issues related with the non-communicable diseases, they have to make sure that early diagnosis is the most important for the prevention of the complication. That is screening programs for the early detection of the condition is the most important. Next one is a chronic disease management. Like a chronic disease, especially with the high blood pressure and the diabetes, if it is there for the person who is having related with the non-communicable diseases, they have to develop and implement the care plan of the individual. That will be including like they have to take the proper medication and the management. They have to change the lifestyles modification, especially with the day-to-day activities. Then regular monitoring of the health is the most important for the prevention of the complication. Then patient education is the most important with this non-communicable diseases. That is providing a education for the patient about their family's diseases, like if any genetical inheritance is there, or if it is a risk factor for the cardiovascular condition is there, we have to give the proper education. That is how they can able to screen those conditions. Then what's the treatment aspect, it will be there. We have to give the education for the patient. Next one is the community based programs. Like they have to take help of the community based program. That is especially with the support of the group, such as with the diabetes or heart diseases, the persons who will be having, to give the proper peer support and the information is the most important. Next one is a multidisciplinary approach. That is how we are going to make this one is the collaboration with the each other. That is healthcare professionals, including with the doctor, nutritionalist, physiotherapist and the social workers, to provide comprehensive care. So this is how we are going to prevention and the control of the non-communicable diseases. Then coming to the other environmental problems. So when coming to this environmental problems, that is also one of the impact for this health problems in India. So this like environmental problems that poses significant challenges to the public health. Then it will be affecting with the biodiversity. Then along with that, sustainable development. So when coming to this environmental problems, you will be coming across with that nowadays there is air pollution. If it is a air pollution is there, what will happen again, it will be impact for the peoples in the community. Like there will be peoples will be having a asthma, chronic obstructive pulmonary diseases. It will be increases with the air pollutions. Then water pollution, if water pollution is there, again it will be affecting with the health of the peoples. Then deforestation, then waste management. So these are the environmental problems you will be come across in the community. Then other national health problems like population problems. So this is also one of the national health problems. So when you're coming to this population problems, there will be several population problems that will be related with the significant impact, that is with the development and the quality of the life. So when you coming through these population problems, you will be seeing there is a overpopulation, population density, unemployment and the underemployment, healthcare challenges, educational challenges and the urbanization. So these are the common population problems. It will be there in India. Hope you understood the session. For more interesting videos, do follow with the EZI Nurse. Thank you.